Hello, my name is Kara West. I'm going to be the nurse practitioner student examining you today. Can I have your full name and date of birth?
Devon West, December 5th, 1990.
Nice to meet you, Davon. We're going to be doing a head to toe assessment today, okay?
Okay.
I'm just going to start by doing a generalized survey, just looking at your appearance. You're not in no acute distress, normal demeanor. You look well nourished and you appear pretty healthy. Vital signs, height and weight are already done. I'm going to start by inspecting your skin. If you could just stand for me.
Okay.
Just looking, making sure your skin is intact, color looks good, no edema, no scars, bruising, anything like that. Okay, looking at your nails. All right, normal nail configuration, everything looks good. Now I'm going to be moving on to the head and face assessment. I'm going to start by inspecting your head, looking at the size, make sure there's no swelling, head appears symmetrical, face appears symmetrical, scalp is normal, hair distribution looks good. Now I'm going to palpate your head,
Okay.
just making sure there's no lumps. I'm going to palpate temporal arteries, palpate your sinuses, making sure there's no tenderness. Then I'm going to listen to your temporal arteries. All right. I'm just going to have you clench your jaw for me. Perfect. And then I'm going to have you open and close, open and close. Perfect. And then I'm going to get cotton. Just tell me if you feel that.
Yes.
Feel that.
Yes.
Feel that.
Yes.
Feel that.
Yes.
Okay. I'm going to have you frown, smile, puff out your cheeks, and raise your eyebrows. All right, perfect. Now we're going to move on to your eyes. I'm going to start by just looking at your eyes, making sure it has normal alignment. I'm going to pull your lids down, look up for me. And I'm going to pull your top lids up and look down for me. All right, normal lacrimal ducts, conjunctiva, no redness to your eye. I'm going to palpate your lacrimal ducts and the orbits, making sure there's no swelling and no tenderness there, right?
No.
All right. Now we're gonna, you got a seat for me.
All right.
We're gonna do a little visual acuity.
Hey.
All right, you can go ahead with both eyes. Go ahead and read the smallest line you can see.
LTFPH.
All right, and then you go ahead and close your right eye. Read the smallest line you can see.
LTFPH.
All right, go ahead and swap the eye. Read the smallest line you can see.
LTFPH.
All right, awesome. All right, now I'm going to have you tell me when you can see my fingers.
I can see him. I can see him.
All right, then you're going to look at my finger. To your nose, perfect. Then I'm going to be checking your pupil response to light. Just look straight at me. Thank you. Thank you. I am going to dim the lights to check for fundoscopic examination. All right, you're gonna pick an object over my shoulder and just look straight ahead, okay? All right. I'm gonna find the red reflex, and then I'm going to zoom in. Okay. All right. Do that same thing. Find the object on my shoulder.
Okay.
I'm going to find the red reflex. Perfect. And then I'm gonna zoom in. Okay. Turn the lights back on. All right. Now I am going to do an ear inspection first. So look at your ears. Check it for symmetry. Making sure sure there's no abnormalities. Okay, perfect. Now I am going to palpate your ears. Any tenderness with that at all?
No.
All right. Now we're going to take a little look in your ears. Sorry, this might tickle. All right. I want to put a tuning fork on top of your head, and you're just going to let me know where you hear it at, okay?
Both ears.
Okay. I'll do it again. It's going to be to the bone of your ear, then I'm going to outside. You just let me know when you stop hearing the sounds, okay?
Stop hearing it. Stop hearing it.
Okay.
Stop hearing it. Stop hearing it.
I'm going to have you stand up for me and face away. We're going to do a whisper test, and you just let me know, repeat what I said to you.
Okay. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
All right, perfect. You can have a seat. Now we're going to move on to inspecting the nose and just looking at symmetry. Your nose appears normal. I'm going to take a light source and look within your nose. Okay. Just looking for patency, making sure there's no abnormalities, no within the nose. Then I'm going to test your sense of smell, and just let me know. You close your eyes. Let me know what you smell.
Alcohol. Alcohol.
All right, perfect. Now we're going to move on to the mouth. I'm going to start by put some gloves on and inspecting.
Stethoscope.
Oh, thank you. Inspecting your mouth. Open up. Just looking at your lips. Closer. Looking at your teeth. Moving your tongue to the side. To the side. Moving it up. All right, say ah.
Ah.
All right, uvula rises in its midline. Thank you. Say ah again.
Ah.
All right, no hoarseness or anything like that. Can you stick your tongue out and move it from left and to right? Okay, awesome. You got good movement in your tongue. Now I'm going to move on to your neck and lymph node area. I'm going to start by inspecting the neck, just making sure there's no swelling, no enlargement in the thyroid or the trachea. Trachea is midline, and no thyroid enlargement. Now I'm going to start by palpating the neck area, just making sure that I feel the trachea. And then I'm going to start palpating your lymph nodes, starting with your preauricular, postauricular, occipital in the back, the tonsillar, the submandibular, the supraclavicular lymph nodes, just making sure it's mobile. Okay, Now I'm gonna move on. Oh, can you move your neck? Can you make your touch your chin to your chest?
Yeah.
All right. Now look up to the ceiling. Now make your shoulders touch the air with your neck. Left and right. Then can you shoulder shrug against my resistance?
Yeah.
All right. Can you turn your head against my hand? Perfect. And can you turn your head against my hand? Perfect. I'm going to listen to your carotid. Okay. Can you stand up for me? I'm going to, you can face away. Well, yeah, you can face the camera actually. And I'm going to palpate your thyroid. Go ahead and swallow for me. And go ahead and swallow for me again. And I'm also, you can face me. Also going to feel for your carotid. Alright, you can have a seat. Alright, now we're going to move on to the respiratory assessment. We're going to start by just assessing your chest, looking for equal rise and fall in respirations. I'm going to, you can just sit up straight for me, looking at your AP diameter, making sure everything looks pretty good. Respiratories are equal rate, regular rate, normal depth. I'm going to palpate your chest now, just feeling for any type of tenderness at all. Okay. I'm going to start actually with the back. So you can turn this way.
Okay.
I'm going to start by percussing first.
All right.
And then while I'm back here, I'm going to percuss your diaphragm.
Okay.
And then I'm going to give you a listen. Just breathe regular.
Okay.
Okay, now you're going to say E every time I put it down. Go ahead.
E. 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 E.
Okay, now you're going to whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2,
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Now you can face me. And we are going to do the front of your chest now. We'll start by percussing.
All right.
Okay. listen. I'm just gonna take some breaths for me. All right, now you're gonna say E.
E. E. E. E. E. E. E. E. E.
And now you're gonna whisper 1, 2, 3, 4.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Okay. And then I'm gonna percuss you. Perfect. Now we're going to move on to the cardiac inspection. I'm gonna start by just looking at you. I'm gonna have you actually head to that way, lay supine on your back. You're gonna look that way. And I'm just assessing your JVD, making sure there's no distension. Okay, no distension underneath your JVD. And I'm just making sure equal rise and fall of the chest as well. I'm gonna palpate with the ball of my hand for any thrill. And then I'm going to use my finger pads to check for any heaves. Find your PMI. Can you lean a little bit towards me? Your whole chest.
Oh, okay.
Yep. All right, PMI is at its adequate location. Now I'm going to do some listening. I'm gonna start with my diaphragm, starting in at the aortic, pulmonic, tricuspid, and atrial. And I'm gonna switch to my bell, listen to aortic, pulmonic, tricuspid, and then mitral. All right, you can sit up for me. Need some help.
No, I'm okay.
I'm gonna give another listen, using my diaphragm, starting in the aortic, pulmonic, tricuspid, and then mitral. Going back to my bell, aortic, pulmonic, tricuspid, and then mitral. And then I'm gonna have you lean forward so I can check for any regurgitation. All right, perfect. Then we're going to move on to the peripheral inspection, starting by looking at your extremities, looking at hair distribution, making sure there's no edema, no swelling, making sure you have normal air distribution. I'm going to check some capillary refill. Right, perfect. Capillary refill is less than 3 seconds on all extremities. Now I'm going to palpate your arteries, starting with radial, brachial. I would have palpated for the femoral. Now I'm going to palpate your posterior patella. And then I'm gonna do your dorsal pedis on your foot. And then the tibial by the ankle. Okay. Perfect. Okay. Now I'm going to palpate the lymph nodes. I'm going to start with the epitrochlear. It's by the elbow. Bend it a little bit. Oh, here we go. Okay. And I'm going to do the lymph nodes behind the knee. Okay. Now I'm going to do some listening to the arteries in your stomach. Go ahead and lay back for me.
I'm gonna lay the low way.
Mm-hmm. I'm going to start with my bell, renal. Renal, iliac, aorta, and I would have also listened to the femoral as well. Now I'm going to move on to the abdomen area. I'm just going to have you to continue laying flat like that. I'm going to inspect the area, making sure there's no swelling, making sure your abdomen is flat, symmetrical, there's no scarring, making sure your umbilicus area looks normal, no redness, no drainage, no bulges. I'm going to have you lift your head up slightly as if you're doing a sit-up, just to check for any herniation. No herniation. Okay, you can rest your head. Now I'm going to listen to all 4 quadrants of your stomach. Right. Okay. Now I'm going to percuss. Okay, and then I'm going to percuss your liver. Percuss the spleen. Now I am going to have you sit up. Just, and you can continue facing that way actually. Where your feet was at.
Put my head down there?
No, just sit up straight. I just gotta tap your back.
Oh, okay.
Just tap in for any CVA tenderness on both sides. Any tenderness when I do that at all?
No.
All right, you can go ahead and lay back down on your back, head that way. Now I'm gonna palpating for aortic pulses first. And now I'm gonna do light palpitation in all 4 quadrants. Now I'm gonna do deeper, might be a little bit uncomfortable. Any tenderness when I do that?
No.
All right, I'm going to palpate the liver. And I'm going to come palpate the spleen. Palpate kidney. And then I'm gonna palpate your bladder for any distension. Okay, perfect. Thank you. All right, now we're gonna move on to the musculoskeletal. You go ahead and stand up for me. Just checking your posture, erect posture, symmetrical. Muscles look symmetrical in all aspects. Strengths look good. No redness, no swelling. I'm going to, you can face me. I'm going to palpate your shoulders, elbows, your hands, wrist area, hips, knees, ankles, and your toes for any tenderness, any crepitus, any deformity. None noted. I'm going to move on to some range of motion tests. I'm going to start with your back and spine. I'm going to have you face this way. Go ahead and touch your toes. All right, you can stand back up. I'm going to have you lean back. I'm going to support you. Okay, perfect. You can face me. And then move side to side like a teacup. Cool, perfect. Now I'm going to test range of motion in your shoulders and clavicles. Go ahead and raise your arms in front of you like this and over your head. And then raise your arms to the side and down. All right, you can place one hand up and put it behind your back. So if you're trying to touch the shoulder blade, okay, then you can swap arms and then go ahead back. Let's try to touch the shoulder blades. And then with your other arm, can you go ahead and try to touch the back of your head as if you're brushing your head all the way back. Perfect. And then you can swap and do it with that hand and touch as if you're trying to brush your hair. Okay, perfect. Now you can raise your arms to shoulder height. Go ahead and drop very slowly, just doing an arm drop test. Okay, now we're gonna do range of motions in your elbow. We're gonna start by bending your elbows and straightening your arms. You go ahead and turn your palms up, so if you're carrying a bowl of soup, and then you go ahead and turn your palms down. Okay, and now I'm gonna do some resistance tests. Go ahead and make a fist for me, and then bend up against my hand. Thank you. Same thing on the side. Bend the elbow slightly. Go ahead and make a fist for me, and bend up against my hand. All right, perfect. Now we're gonna move on to your wrist. With your palms down, go ahead and point your finger to the floor, and go ahead and point your fingers up. And then with your palms up, go ahead and move your fingers inward to the center of your body, and then go ahead and move them outward to the outside of your body. And now we're gonna do a grip test. Go ahead and grip my fingers. Checking for any strength test. Okay, that's good. Now we're gonna do fingers and, fingers. Go ahead and make a fist, and go ahead and open your hands out. Go ahead and bring your fingers together, and then go ahead and fan them out real wide. Perfect. Go ahead and put your hands up for me like this, and go ahead and put your thumb across trying to touch your pinky. Perfect. And then go ahead and put your thumb away. And then you're gonna move your thumb to your hand, and then you're gonna spread out again like a goalpost. All right, then you're gonna move your thumb to each fingertip. Thank you. All right, and then we're gonna do the Frankenstein test. So you're going to make a fist, and I am just going to manipulate it side to side. Thank you. Side to side. Any pain when I do that?
No.
All right, now we're gonna move on to the hips. You go ahead and lay on your back with your head in the usual position. All right, like that. Bend each knee to your chest, trying to pull into your abdomen. Perfect. Go ahead and do the other one. Perfect. All right, now I'm gonna have you roll to your stomach. And then lift, while bending your knee, go ahead and lift this leg up, all the way up. Perfect, and then swap sides and do it with the other one. Perfect. Okay, you go ahead and lay back on your back again. You're gonna go ahead and take this leg and move it towards the center of your body.
Left leg?
Yeah, I'm sorry, not the center. Away from the center of your body, outward. Okay, and then do it with your right leg. All right, and then with your left leg, go ahead and cross the center of your body. All right, and then cross this one to the, yep. Thank you. And then we're going to bend your leg slightly, and then you're going to take this part of your lower leg and go ahead and fan it out for me. Good job. And then go ahead and cross it up. There we go. Perfect. We're going to do it with this leg now. Go ahead and fan your lower leg out and cross it across the center. All right, go ahead and put that down. Now we're going to do some strength tests for your hips. Go ahead and pull this leg back into your chest again. I'm just doing the Kendall's test to make sure the other side doesn't raise. All right, go ahead and swap the other leg. Just making sure that side doesn't raise. Okay, perfect. You can sit up for me. We're going to touch your knees next. Go ahead and bend your knee.
Bend it?
Yep. Both of them. You can do both at the same time. Perfect. And then go ahead and straighten them. Straighten your legs out. All right. I'm going to have you lay back for me. We're going to do the McMurray test. I'm just going to have your ankle and then your knee. We're going to go back. And we're going to go forward. And we're going to go back. And we're going to go forward. Okay. Relax and do the next one. Bend at 90. Get your ankle outward. Go back. Any pain when I do this?
No.
And go forward. Perfect. Go back. And go forward. All right, go ahead and relax. Now we're going to test the range of motion in your ankles. You go ahead and sit up. With your point your toes to the floor. And then go ahead and put your toes up. And then you're going to turn the soles of your feet inward. And then you're going to turn the soles of your feet outward. Okay, perfect. Now you're going to spread your toes out. And then you're going to go ahead and curl them in. All right, now I'm going to do an Achilles test. I'm just going to have you lay on your stomach across the bed. I'm going to squeeze your calf and look for a jump in your Achilles. Okay, go ahead and sit up for me. We are going to do a neuro exam. I'm going to start by asking you some questions to make sure, just to check your orientation. Can you tell me what year it is?
2025.
Can you tell me your name?
Devon West.
Can you tell me your birthday?
12/5/90.
Can you tell me what time today's appointment is?
2 p.m.
All right. Can you tell me where you are right now?
The doctors.
All right. Can you tell me your anniversary?
September 30th.
All right. And now I'm going to ask you some questions. Can you tell me how an apple, well, patient is A&O times 4. Can you tell me what an apple and orange have in common?
They're both fruit.
All right, perfect. And also, can you spell world backwards?
DLROW.
Perfect. I'm going to do a finger to nose test. You are going to take your left hand, touch your nose, touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Okay, you go ahead and swap. Touch your nose, touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. All right, no tremor noted. And then I'm going to have you reach for my hands. And no tremor noted with intention. You go ahead and relax. With your eyes closed, I'm going to move your fingertips in a certain direction. Just let me know which way I'm moving them, okay?
Okay. Up, down. Up, down.
Okay, perfect. I'm going to have you, with your eyes closed, go ahead and stand safely. I'm just going to assess your ability to balance. Okay, good balance. Perfect. You go over your eyes now. I'm going to have you do heel to toe walk. Perfect. And now you can just walk regular so I can assess your gait as well. All right, both of them are fine. Patient has good ambulatory gait. I'm going to do a sharp to dull test on you. You can go ahead and have a seat. I'm going to touch you in some parts of your extremity. Just let me know if it's sharp or dull, okay?
Sharp,
Close your eyes.
sharp, 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 charge.
Okay. Keep it with your eyes closed. I'm gonna be touching you. Just let me know if you can feel it, okay?
Feel it. I can 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 feel it.
All right. I'm gonna be touching you in your extremities. Just let me know what kind of sensation it feels like, okay? You can go ahead and cross your hands for me.
Vibrating. 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 Still vibrating.
With your eyes closed, I'm gonna put an object in your hand. Can you identify the object for me?
Coin. A coin.
Okay. And now we're gonna do some reflex testing. I'm gonna start by, thank you. Start by doing your bicep. I'm doing your tricep. And we're gonna do radial. And we're going to do the knee. Then we're going to do Achilles. And then we're going to do the bottom of the foot, the plantar. Sorry, this might be a little uncomfortable. Thank you. Thank you. All right. Any questions?
No.
All right, that includes our head to toe assessment.